Hello and welcome to another episode of Right Brain Rounds. Today I have Dr. Joe Sherman with us. He is a pediatrician and he's also a professional development coach for physicians. And I'm going to let him talk to us today about all of the resources that he has and his experience through the Physician Coaching Institute on how he helps other physicians in their careers with resilience. So thank you.
Thanks for having me, Corinne. I appreciate it.
So tell us a little bit about your career and how you went from pediatrician to executive coach.
Yeah. So I am a general pediatrician, and I took that straight shot route from undergraduate pre-med, although I was in biomedical engineering when I was in undergrad, mostly because I wanted something to fall back on in case I didn't make it into medical school. Many of us are always worried about whether we'll get in to the next step along this line. So, but I really wanted to be a physician at the time. And I wanted to be a pediatrician specifically. And I don't know if I had not been a pediatrician, whether I would have been another medical specialist or whether I would have been in some other profession with kids, teacher, counselor, coach, something like that. But went through medical school as well as residency in pediatrics in Richmond, Virginia at Virginia Commonwealth University, Medical College of Virginia at the time. And then I practiced in my hometown of Washington, D.C. And I soon found out that my area that I really felt drawn toward was working with underserved populations of kids, mostly in the inner city. So I have worked most of my career in teaching and training residents and medical students in community settings. Mm-hmm. And that's what I really enjoy doing. I enjoy bringing trainees and younger physicians into the actual neighborhoods and the lives of the families that they're trying to serve. I think sometimes as I look back at my career, I think I'm kind of a medical social worker disguised as a pediatrician, but I think general pediatrics, there's a lot of social work involved. So that's what I've enjoyed doing. And I did it with several training programs in pediatrics as well as family medicine, in working with family medicine doctors. I also, in my career, have had longer stints overseas, 2 years working in Uganda, doing maternal child HIV transmission prevention work in the 90s before there were antiretrovirals available there. That was a challenging time. And then another 4 years with my whole family, my kids, my wife, in Bolivia. And we worked for a mission organization in Bolivia. And I worked as a pediatrician in a small town in the Andes with indigenous Quechua population in Bolivia. And then I've been working since probably 2000, other than that time in Bolivia, here in the Pacific Northwest in Seattle, as well as Tacoma. And again, trying to work with community organizations and community settings, as well as teaching and training. The way I became a coach came when I returned from Bolivia after being there for 4 years. This was in 2009. And I tried to just plug right back into kind of the career that I was drawn toward for most of my life. But I don't know if I was a different person or my eyes were opened a bit more in Bolivia, but I just didn't fit into the system like I used to. And I think part of it was that at the time, there were a lot of cuts in the clinic that I was working in. I was a medical director of a training clinic. And And I tried to make up for all of those things that were deficient in the system. And so if people were upset about the administration, then I tried to take the place of their support that they weren't receiving from the administration. If people were falling behind, I would try to catch up with their patients and try to help them move along. So I really did try to be the fixer and try to be the one that made everything right for everybody else. In the meantime, I was gradually sinking lower, 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 increasing anxiety, bouts of depression, just because I felt like I didn't understand. I was doing what I thought I was supposed to do, and yet my mental health was suffering, my physical health was suffering, as well as my relationship with my wife and my family. So I stopped altogether. It was really a time that was a very challenging and dark time in my life. I didn't really know if I was going to stay in medicine or not, but spent a while kind of recovering and with the help of a lot of support from therapists, coaches, spiritual directors. I'm one of those people that like to have a sangha of people around me to try to help support me and guide me along the way. I started to realize those aspects of all of the jobs I've had in my career that were consistent, with core values that I held near and dear. I touched on this. I'm a reflective person, so I journal a lot. So I kind of knew these things, but I never really went through a deliberate process of trying to identify core values and then use those specifically to make further decisions in my career. By doing that, I was able to start working part-time in places that really were a good match for me. And there were a lot of aspects that had to do with that. But in the meantime, I also wanted to help other physicians find their path in life, find their the place where they felt like they could. The best way to put it is borrowed from Parker Palmer, who started the Center for Courage and Renewal, where you can match soul to role, where you can truly find that your role in life is a manifestation of who you truly are at your essence. And that's what I try to do with my coaching clients now. Sorry, it's a long story, but that's kind of where I got where I am.
That's truly amazing. And I think you touch on a lot of wonderful subjects that apply to physicians who are going through burnout or, finally starting to recognize that that's what it possibly is that they're dealing with. And, aligning with your core values in an institution or, you know, um, whoever you're working for, making sure that those things align and that you're in the right place for what it is that you want your legacy in medicine to be, seems to be, a big push these days. And, once a physician recognizes that and can kind of work towards being in places where they align with those values of those organizations, or even working for themselves or, doing something totally different outside of medicine, and, feeling appreciated. But I think it's wonderful that you are able to share your experience and say, this was something that really bothered me. And so much so that I had to step away from medicine to kind of figure that out. And I think dealing with the medical culture and how we as physicians aren't really trained to ask for help or get help for ourselves, without shame. I think that's something that, you know, I love to help other people through. Um, and so, you started coaching people and sharing your experience. in the field of medicine, which is so vast. And what are you currently doing with physicians?
So with this journey for myself, and again, whenever I talk about this, I always emphasize that I'm still on my own journey. It's not like I've arrived somewhere and I want to come help everybody else, reach this place of enlightenment that I've arrived. I am just one step ahead of my clients. So, and sometimes I'm not. Sometimes I'm one step behind and they teach me. So I have to constantly work with my own practices of mindfulness, self-compassion, my own tools of increasing my self-awareness of what triggers me, of what draws me, what I'm passionate about. So in the beginning, I was drawn toward this group process that was, like I mentioned, the Center for Courage and Renewal. I was drawn toward a book called Let Your Life Speak, written by Parker Palmer. And the basic premise was all about learning about yourself through your experiences. You can look back at your experiences and say, wow, that was a time when I felt like that was truly me. That was not me trying to be what other people wanted me to be. And it was in that moment, in that activity, that I really felt that I was calm, I was centered, I was excited, whatever that emotion is that makes you realize that this is truly you. And you can take that experience and you can almost dissect it. You can look at it and go, who are the people involved? What was the setting? Um, what was the activities involved? What were the physical sensations I experienced? And then you can now look and see what other activities or what other jobs, what other careers can I move toward that will give me that same experience. And in doing this, you learn more and more about yourself and you can grow through this process. So I did it first in a retreat format with other people. Some were physicians, some were not. And then I moved on from doing this kind of collective work that I now continue to do with both medical teams as well as individuals coming together. And I added on later through the Physician Coaching Institute, the one-on-one direct coaching with physicians and other health professionals. And that's what I do now. I do a combination of one-on-one coaching, medical team building, as well as retreats where individuals come together.
And, I think it's really important to emphasize too that coaching can be a lot of self-discovery and is not, always a punitive thing. Like if you're coaching within an institution and someone says, hey, physician so and so, you might benefit from some coaching. Like it's, maybe someone is in trouble. Maybe there's something clinical going on that needs to be corrected as far as like physician performance, and maybe that's how that person was identified as someone who could benefit from coaching. But I think that is really important to put out there, is that coaching, asking for help, being coached isn't always something that is punitive and can actually be really helpful.
Yeah, absolutely. I think you hit it on the arena. You come also from a business perspective too. And I think those folks that work in a corporate environment, in a business environment, when you talk about coaching, very often they look on that as being a great perk, a great benefit. This is going to be someone that's going to help me grow in understanding myself and the kind of leader I can be. In medicine, you mentioned before this concept of shame. And I have to say that shame is something we learn very well through our medical training. And most of our medical training and the culture of medical training is based on criticism, what you're doing wrong, shaming people, and using this as a motivation for people to improve and to perfect their skills. The reality is that this method, as tried and true as it has been throughout generations of doctors, has been proven by research to not be nearly as effective as self-compassion, of being supportive, of trying to emphasize what people are doing positively and what they're doing well. This is a much better motivator for people to truly head in a direction that's more self-directed, that really helps build inside of them this internal locus that helps them feel resilient and can sustain them on their path moving forward. So there are clients who are referred to me by organizations because they've fallen behind in charting, or they're being disruptive within the work environment, or they seem to be falling behind in other aspects of productivity and such. And very often when I work, well, all the time, whenever I'm presented with that client as a potential client, I tell the sponsor, this person has to want coaching, has to understand what coaching is, which is really that I'm their advocate, I'm their ally, I'm someone who truly believes in them more than many other people might believe in them, and that I'm there to help them and to be of benefit to them. And I'm not there to try to tell them that they're messing up, that they're falling behind. They've already been told that. They know that. By the time they reach me, they've been told that by many people. So I don't have to reinforce that. But what I can do is work with them to understand what's underneath all of that, what's underneath the behavior, or what's behind them falling behind in this work. Maybe it's that they don't want to be doing that work. Maybe they're in the wrong place, or maybe it's just that they're still holding on to these antiquated ideas of perfectionism and having to get everything right and wanting to look good to our colleagues that we were taught, and it's drilled into us throughout all of our training. So some of it is this idea of reframing what coaching is. And coaching is not here to kind of be remedial and to try to kind of bring you up to snuff and up to standards. It's to truly to help you understand yourself better and what direction is best for you.
And I love how you brought out the business analogy of, when people are coached in business, it sounds like a wonderful opportunity. It's afforded to CEOs, people who are making daily multi-million-dollar decisions. And when you equate that to a physician career, I mean, physicians are taking care of lives, patients, people. And what is, equal to that? What kind of price tag can you put on someone's life? I mean, this is what these people are in charge of. When you go to take your mother to the physician, they are doing many things, adjusting medications, talking to them about symptoms, trying to diagnose things. And, that mind needs to be in tip-top shape. They need to be healthy too. And that means emotional, physical, and, intellectual health. And what kind of investment do institutions need to put into coaching to help, the wheels of their system keep running smoothly? And, we all know that patient outcomes are improved when there's not burnout in the practitioner population. And, to be able to say that this is totally worth it for a system is, something that needs to be promoted.
Yeah. And I think this idea that that somehow providing coaching is something that is always looked on as being remedial is something that is evolving and is changing as time goes on. And I also believe that the world of medicine that I encountered coming out of training in the 80s is so different than what providers, physicians are facing today. I mean, I remember my first job out of residency was in a private practice pediatric group. And there was no contract. There was nothing I signed. There were no negotiations. I just shook hands with the partner and said, "Hey, welcome aboard." And all paper charts, no such thing as computer charting, nothing like that. And the notes had a date, a diagnosis, and a treatment and a signature. That was it. And people went along their day and didn't weren't bombarded with everything coming through the EMR that comes through now. So, I'm not one of those older physicians that says, well, you got it great now. Back in the old days, we worked much harder. I'm actually the opposite. I say, back in the old days, we could write a very short note and go home and not have any work to do in the evenings or on weekends. So, from my perspective, it's much more complex and much more challenging to be a physician these days. And you need to develop the tools that help you understand how to set healthy boundaries, how to live a balanced life, how to refill your physical, spiritual, psychological, and emotional tanks after you've expended all of that throughout the day, taking care of people who are truly in distress. So you can be fully present to yourself, them, and your family.
And, I know that there are so many different types of coaches these days too. I mean, the charting coaches, weight loss coaches who are physicians. I mean, like, you identify the problem, there's someone there to help you fix it. And, just being willing to reach out and or recognize that this is a problem and how can I get help for it? I mean, there's someone out there for you. If anyone is out there struggling in a medical career, someone has been through it and can help you.
Yes, there's a variety of coaches. I think one thing that's important for for folks who are trying to decide whether coaching is something that might be helpful for them is to understand the difference between like a therapist, counselor, mentor, and coach. And what I often tell people is that we're used to having mentors in medicine, those people that are ahead of us in this pathway that we are walking in our careers. And this person we try to look up to, maybe a role model, someone who can give us advice as to the path that they took and how we could somehow avoid the pitfalls that they ran into and perhaps have a smoother trail. A coach, on the other hand, walks alongside of you. A coach doesn't know. I have no idea when we first worked together whether you were going to stay in your same job, whether you're going to quit and go to a different job, or whether you're going to make certain decisions about your family and your career. So instead, I'm walking alongside of you. I'm trying to help ask the right questions for you to access the wisdom and creativity that you already possess. And a lot of people can't understand that because many of the clients I get are either burned out, disillusioned, they've headed down one pathway, like they've been on a freight train headed charging down the tracks, and all of a sudden they decided to jump off, or they're not sure if they want to jump off because they're scared. So the fact that they actually possess the wisdom that can help them make the right decisions in their lives doesn't seem possible. But once we're able to kind of really provide that framework and that support and that trusting, safe relationship, then all kinds of things can happen as a result.
And, just really helping that client recognize that they do possess that, intellect to apply they went through medical school. There's something there. And, to kind of follow through with, different challenges or homework assignments that a coach might put out there, for them to consider and contemplate, when they're making bigger life decisions, because really they're the ones that are best equipped to make those life decisions. But, with the aspect that a coach can put out there and those challenging questions that maybe people in their lives are afraid to ask them, or, they haven't thought of before. Just a different perspective. So I love how you explain the difference between, coaching and mentoring or therapy, because yes, that is a big difference. And it's very well delineated when entering a coach-client relationship. And so, I'm interested in your experience, and like when you're talking to someone for the first time and explaining to them, this is how our coach-client relationship will be. Sometimes you might have people who talk to you and say, yep, I don't think this is for me. But, how do you address people when they first meet with you?
Yeah, most of the time, I offer free consultations because most of the reason I do that is because by the time physicians, like you say, this idea that if you ask for any kind of help, it's a sign of weakness, that's kind of what we've been taught through our training. So by the time people actually, draw up enough courage to schedule an appointment to meet with me, I figure that they've already been through quite a bit of self-doubt and overcoming some of that second guessing and have reached that point. So the first thing that I do is try to reassure them and listen to them and really hear what they have to say about their situation, what it is that really is bothering them, what it is that that truly has drawn them toward really wanting some help. And then I may ask some clarifying questions about things that they brought up and things that they alluded to that maybe they weren't aware of before because they have never had somebody as a sounding board listen to them like that. And then I explain to them kind of what coaching is, and that I'm not the person that's going to tell you, oh, yes, this is the job you should take. Go in that direction. Instead, I'll be the person that says, based on the work that we've done and the values that you've identified and those things that you've already experienced that you want to try to avoid, where does this job fit in to all of those criteria that we've already identified? And then the client themselves can kind of come up with the answer of which direction to take. So I always try to explain what a coach does, what I would be doing. And then I just had one of these consultation meetings this morning with someone who was just newly hired to an executive position within a healthcare organization. And the last thing he asked me in the consultation meeting was, is there something else I should be asking you? Is there something else that I should know? And I said, that's a wonderful question. And I said, the bottom line as you try to decide whether this is for you or not, or who the person is for you, is how you feel with that person, the chemistry. Do you feel like this is someone you feel comfortable being yourself with? Is this someone that you feel like you can be completely honest, and is someone that will hold you in that container, support you, and challenge you in a way that truly believes in your ability to succeed and to discern the right direction to take. And if you have that feeling like this is somebody I could work with, this is somebody who gets me, who feels me, who hears me, then that is somebody that can really take you a long way.
That's so excellent. I think that, like you said, the first step is that people have to recognize that they need the help. And by the time they've been through all the things that a medical career can bring to you, as far as maybe some micro traumas, and some good things, um, that, by the time they're signing up and putting themselves on your calendar, having a free consultation is probably very, reassuring to people. And then, they get an idea of who you are and what core values you have and how they can help themselves achieve their, autonomy with their, current organization, or, ask those challenging questions about if they should stay, or, what's best for them, their family, their career.
Yeah, and again, I'm growing in this too. I'm constantly learning. I would say I'm constantly learning how to bring more of myself to the coaching relationship, and to really trust that when people say, "What is unique about you? What is it you bring?" I don't. I'm constantly battling, because medicine teaches me that I need to have these skills. I need to know how all of the science involved with making the correct diagnosis, with coming up with the right treatment plan, and following through with that treatment plan. So I have to have these basic skills in order to do that, and to have this basic knowledge. But the reality is, what I bring to the coaching relationship is myself, who I am. And that's the difference. So the more that I can be true to myself, and to say to someone who is really looking for a consultant or a mentor to just tell them what to do, that I'm not going to do that. I can't do that. There's a great temptation for me to do that, because that's what I do in medicine. I tell medical students and residents all the time that, what do you think you would like to do in this situation? And then they make a guess and they say, but I really don't know. And I said, well, of course you don't know. You haven't been exposed to that. So this is what is the correct treatment, or whatever that might be. But in coaching, that I have to take that hat off and put on a completely different hat, which is a hat of appreciative inquiry, of compassion, of mindful listening, of redirecting, and of summarizing and encapsulating, and sometimes challenging people on their limiting beliefs of the way they see things. And I can challenge them to say, wow, is there a different perspective here? You seem to describe that situation as if it's all about you and everything that went wrong with you, and what's wrong with you, and how you fell short. Could it be that there's some other factor involved with other people that you're interacting with, or the system that you're working within? So, yeah, giving that different perspective, I think, is something that I can bring to the table.
And I kind of liken it to my medical career as far as coaching. I have been through professional burnout and have overcome that in my own ways with help from physician coaching. I can also talk to my patients as an OBGYN about what it's like to have a C-section, what it's like to have gestational diabetes and be treated for that, what it's like to have, an abnormal genetic screening test. And, I feel like those things happen to me in medicine so that I could better relate to my patients, or have a little bit of an idea of what they're going through. and say, at the right time, the right situation of, hey, I've been through this too, and I understand why you don't want to have a C-section. And this is why I have a higher threshold for recommending C-sections, because I know what these people go through, right? Or, this is, something that worked for me, using goal strategies in overcoming burnout, and, putting that out there to clients. And, another similarity I feel is like bringing up differential diagnosis. I'll look at some images of a fetal ultrasound and say, oh, this could be spina bifida. This could be, a cystic hygroma, or, club feet, this is what it could be, and have my list of my differential diagnosis. And then in a coaching client relationship, that client could say, okay, these are the different ways that I could, deal with this specific business or, career transition. And, put out all the different ways that you could respond to that. And so I think it's wonderful to really delineate, again, the difference between coaching therapy and, being a physician treating someone, and showing some of the similarities on how, as a physician coach to other physicians, how we can relate in that peer-to-peer relationship and non-hierarchical relationship too.
Yeah, I think you bring out a great point in saying how by being a physician who is coaching other physicians, we can bring the experience that we have had through the culture that we've been brought up in, with the understanding of that culture, as well as what it means to be face to face with patients in some of the most difficult times of their lives. And what helps the most, I think about for myself right now, I spend more time as a patient and accompanying other patients and family members than I do as a doctor in treating patients. And being on the other side of things, it's fascinating what it is that attracts me to a medical provider. And it is not so much this huge fund of knowledge, but it's somebody who truly listens to me and truly understands and gets me. Because I worry about my health. I worry about things. I know too much. So when I go into the doctor's office, I'm thinking, I'm not looking for you to say, what test do you want me to order? I'm looking for you to say, I hear what you're saying, Joe. I understand what your concerns are. And I can tell you that I believe that this is not something to worry about. And I don't think that that's what it is. That's what I want to hear from my physician, not, oh, yeah, whatever you want me to do, I'll do. And so I think as a coach, the first and foremost, I want to make sure that I truly listen to people. And if I don't understand exactly, then I'll ask more questions. That's one growing point for me as a coach. And I have my mentor, and I'm constantly trying to grow as a coach. And my biggest growing edge is to, when I want to make a statement or give advice, instead replace it with a question and to see what the wisdom is that exists inside the client. I do that as a pediatrician. I think you mentioned about what you've experienced as yourself personally, and how that helps you take care of patients who are going through similar experiences. For 10 years, I was a pediatrician who was not a parent. And I have to say that I was an expert in everything in those 10 years. And then I had my kids, and I had 2 kids. And I would say that as they have grown over the years, then I become less of an expert in pediatrics and children as I get older. And those are the times as a pediatrician that I go into an exam room and a parent will bring something up. Before, I used to have a pat answer that I knew was the right answer. Now I usually throw it back and say, well, there are many ways to approach this. What have you been experiencing so far? What's worked for you? What hasn't worked for you? Let's start there and then see if we can come up with a plan together. Because I know how hard it is to be a parent. It's the hardest job I have. So, there are so many lessons that I continue to learn as a coach.
And, I think it's really important too, to put out there to the world, to all of the physicians who are listening today, the resources that you have to help them, so if, Dr. Sherman resonates with you and you think you want to work with him, we're going to put a whole bunch of links in our show notes to how you can get in contact with him. And also, he's got a wonderful recurring retreat that I want to talk to you a little bit about, that people can attend, and it just sounds amazing. So take it away.
Okay. So as I said before, my services as a coach range from individual one-on-one coaching with physicians, nurse practitioners. I've worked with vets, I've worked with PTs, I've worked with all kinds of health professionals. And then I also work with medical teams. And these can be, I've worked with palliative care teams, I've worked with outpatient primary care teams, I've worked with all kinds of different medical teams and trying to help develop a community that can support each other as they try to care for their patients. They can care for each other as well as their patients. And then the third thing that I do is that I provide and co-facilitate retreats that bring individual physicians, nurse practitioners, PAs together for a long weekend, 4 days, on Whidbey Island in the Puget Sound here in the Pacific Northwest, in a beautiful setting. And it is a retreat entitled Physician Leadership for Transformational Change. And what this is a chance for us to understand ourselves, what drew us to medicine, what it is that really sparks us and brings us life, and then in turn, how to bring that out in others within our organizations in order to transform the organization from a bunch of people that are just doing what they're told to an organization of engaged individuals that feel like they are invested in a common mission and that they feel valued in what they're able to contribute in that mission. So the next time that this is going to be offered is September 19th through 22nd of 2024. And the information's on my website about how you can get more information about the retreat and registering for that retreat coming up.
What's your website, just so if listeners are listening, they can pop on in?
Sure. It's easy. It's my name, joeshermanmd.com. So if you just search for joeshermanmd.com, you'll come up with my website, and you can reach me directly by email with the address of Joe, J-O-E, at joeshermanmd.com. And I have on my website, I describe my services. I have also articles and resources, lots of resources about self-compassion, which is my go-to practice when I get triggered and I start to feel like I can't really do this, as well as many other resources that can be helpful for folks.
That's wonderful. And in closing today, is there anything that you would just want to put out there to our listeners that is kind of a beacon of hope for people that might be struggling in a way to, achieve resilience in their physician career?
Yeah, I would say that, we've just been through one of the most traumatic experiences as a country, as a world, and definitely as a profession as we've gone through the COVID pandemic. And through that, I feel like the curtain has been pulled back on all that physicians struggle with, and the more and more complexity and technology that enters healthcare, the more challenging it's going to be for us. So if you're out there and you're feeling like you're just not matching up to the expectations you've put on yourself or that an organization is putting on you, just to realize that you're having a normal reaction to an abnormal situation. And very often it's helpful to reach out and get some help to gain some perspective. A coach is a great way to do that. A therapist is a great way to do that. I think for myself, I find both to be helpful and working in conjunction with one another. So you're not alone. I know you feel alone, but there's a whole community of people that are out there that are feeling the same way, and that there is a possibility of improving your situation. You just need to reach out for some help.
Yes. Asking for help, the first step. And I totally thank you for that advice. And again, if anyone wants to get in touch with Dr. Joe Sherman, we will have all of his connections in our show notes. And I truly appreciate being able to meet with you today and to put all of this out to our physician listeners. And thank you so much.
Thanks for having me, Karina. I appreciate it.